All right, everybody, buckle up because we're going on a deep dive today. And no, we're not talking about scuba gear and coral reefs, though that would be pretty cool.
Save that for another time, maybe.
Yeah, maybe. No, today's adventure is all about the 18th century.
Ooh, the 18th century. You mean powdered wigs, revolutions, that kind of thing?
Well, we'll touch on those, but we're actually going even deeper, get ready for it, into the surprisingly fascinating world of public health.
Public health in the 1700s. Now, that's a deep cut. I bet most people don't even realize that was like a thing back then.
Right. You think 18th century, you think leeches and funny hats. Not exactly the picture of medical sophistication.
Well, get this. This wasn't just about treating a sniffle here and a cough there. This was a time when health went from being like a totally personal matter to a major political and economic issue.
Okay, now that's interesting. So tell me more about this big shift. What sparked it?
It's a perfect storm, really. You've got populations booming, cities exploding in size, think London, Paris, and all this new knowledge floating around. Suddenly, everyone's health was, well, everybody's business. And that's where our friend noso-politics comes in.
Noso-politics. Okay, you're going to have to unpack that one for me. It sounds a little intense, like some Orwellian nightmare.
It's not quite as ominous as it sounds. Basically, it means governments caught on to this idea. A healthy population equals a wealthy population.
Ah, so that's where the politics part comes in.
Exactly. And it wasn't just top down from the government either. You see groups like the Quakers way ahead of the curve, setting up these social health initiatives like way before it was cool.
So it was less about charity and more about, what, maximizing productivity?
Bingo. A healthy population meant a productive workforce. And that was music to the ears of, well, anyone in power.
That makes sense. But how did this new no-so-political thinking actually play out? What changed on the ground, so to speak?
This is where hospitals get a serious makeover. Instead of being seen as, like, places you went to die.
Yeah, I imagine they didn't have the best reputation back then.
Not exactly. But in the 18th century, they start to become less about doom and gloom and more like, well, investments.
Okay, so from avoid at all costs
Yeah.
to what? Let's get everyone healthy and productive.
You got it. See, treating people at home might seem cheaper at first, right? But if everyone's sick and can't work, the economy takes a nosedive. So hospitals, they start to look like a pretty smart investment. Keep people healthy, keep those wheels of industry turning. Our sources point to three major drivers behind this shift.
All right, hit me with those drivers. What were they?
Driver number one, cost effectiveness. A sick workforce is a drain on resources. Hospitals become the key to, maximizing those human resources.
Makes sense. What's next?
Driver number two is the medicalisation of the family. This is where doctors really start to shine. They emphasized a healthy home environment, good hygiene, ventilation, all that good stuff. And who better to advise families on all things healthy than, well, the doctor? This naturally boosts the status of hospitals, right? They become training grounds for these practices.
So it's not just about treating the sick anymore. It's about preventing illness in the first place.
Exactly. And driver number three, spatial control of disease. Now, early hospitals, let's just say they weren't exactly known for their sparkling hygiene.
I can imagine, yeah.
Right. But in the 18th century, we see this shift towards hygiene and observation within hospitals. They become less about cramming the sick together and more about controlling the spread of disease.
So talk about a 180. Hospitals go from being part of the problem to, like, a big part of the solution. Are there any real-world examples of this new approach in action?
Absolutely. Take the Red Lion Square Dispensary for Poor Children, established in 1769. It was all about prevention, early intervention. A far cry from the whole come here to die reputation hospitals had before.
That's amazing. It's incredible how these pieces all fit together. But, and maybe this is where we wade into some murkier waters, this whole public health push, it wasn't entirely driven by altruism, was it? Our sources mention this rather unsettling phrase, the necessitous pauper.
Yes. You see, poverty and illness, they become intertwined in a, shall we say, complicated way. The goal was to transform the sick poor into a useful labor force.
Okay, that doesn't sound particularly compassionate.
It wasn't, really.
Yeah.
And that's the crux of it. This wasn't always about compassion. It was about economics. It was really about, boosting the economy. The thinking was, instead of just giving handouts, let's focus on making the poor, well, less poor, more productive members of society. It's a complicated legacy, that's for sure.
It really is. And it wasn't just about adults, right? Sounds like children were also caught up in this future productivity mindset.
Oh, absolutely. Children. They were like prime investment opportunities. A
Right.
healthy child, future worker bee, ready to contribute to the hive of society.
Mm.
Even those 18th century child rearing manuals obsessed with molding kids into productive citizens practically from the cradle.
Wow, talk about pressure. It's like the pressure we put on kids today to get into the right schools, get those high-paying jobs just a few centuries earlier.
Right. It's a fascinating parallel, isn't it? And all of this speaks to this huge surge in the influence of doctors during this period. I mean, they weren't just treating individual patients anymore.
No. What else were they up to?
They were shaping public policy, advising governments, like they were the original health influencers.
So instead of just whispering in the ears of sick patients, they were, what, shouting their wisdom from the rooftops.
Exactly. Publishing books, giving lectures, even weighing in on urban planning. Doctors were everywhere, shaping the way people thought about health, the role of the state in all of it. It's a big deal.
It's amazing when you think about it. Clean water, garbage collection, things we take for granted. Our 18th century ancestors were really figuring this stuff out.
Absolutely. And a lot of their efforts, they were driven by this new understanding of noso-politics. They were laying the groundwork for public health advancements we benefit from today. Take quarantine, for example.
Quarantine seems so, I don't know, intuitive now.
Right. But it really took center stage during this era as a vital tool for containing disease.
It's amazing how something that feels so obvious now, isolating the sick, emerged from this complex web of like social, political, and economic factors.
Exactly. And it wasn't just quarantine. This is also when we start to see the rise of data collection and analysis in public health.
Hmm.
The think censuses, mortality rates, all those statistics we rely on today.
They were already geeking out on data back then. Sounds like the very, very early beginnings of what we now call evidence-based medicine.
Spot on. They were laying the foundation. And this focus on the health of the nation, well, it raised some interesting questions about individual liberties, too. Something we're still grappling with today, right?
Totally. It's like, where's the line between public health and personal freedom? Did everyday people have any say in all of this?
That is the million-dollar question. On the one hand, people were becoming more aware of hygiene, personal responsibility for health. It wasn't all top-down control, but these ideas were often intertwined with existing social hierarchies, who had power and who didn't.
So it wasn't just about health. It was also about morality. Who gets to decide what's right for everyone?
Exactly. Take the emphasis on mothers maintaining a healthy home. Empowering for some, sure, but it also reinforced traditional gender roles. And let's be real, it put a huge burden on women, especially poor women, who might not have the resources to meet these, often idealized standards.
Yeah, that's a good point. It's like a double-edged sword. This whole no-so-politics thing, it's fascinating, but also, yeah, a lot unsettling. Like, did anyone ask the poor families if they even wanted to be part of this grand experiment?
It's a valid question, and it highlights this ethical tightrope walk you see in public health, a tension that continues to this day. I mean, think about mandatory vaccination. It was just emerging back then, and it sparked huge debates, just like it does now. Individual liberty versus collective well-being. It's messy, it's complex, no easy answers.
Definitely food for thought. And speaking of complex legacies, we shall touch on hospitals again. We talked about how they were being reframed as like engines of public health, but I imagine this wasn't universally welcomed.
You're right. While some saw hospitals as symbols of progress, others saw them with suspicion, even fear. And to be fair, these fears weren't totally unfounded. Early hospitals, they could be dangerous places, especially for anyone with infectious diseases.
So it's not surprising that people weren't exactly like lining up to embrace the hospital as the solution.
Exactly. In fact, you see these alternative models of care popping up, like the dispensary movement.
Dispensaries, like for medicine?
Yeah. They aim to provide affordable health care to the poor, but in a less intimidating, less institutional setting than a hospital.
So sort of a middle ground, caring for the sick without resorting to the often feared confines of the hospital.
Yes. And this tension, this debate between different approaches to public health, it's a recurring theme throughout history.
Right. It's a good reminder that even in the midst of these seismic shifts in how people thought about health, there wasn't one right way to do things. Even back then, it was about finding the best path forward, even with all these differing opinions and approaches. It's amazing how much ground we've covered when it comes to 18th century healthcare. And it definitely wasn't all like sunshine and roses, right? There were bumps along the way, disagreements, even some pretty heated debates.
Absolutely. One of the most interesting things we haven't explored fully is this tension between, well, the rise of public health and this deeply ingrained reliance on, traditional families.
Right. We talked about doctors kind of like inserting themselves into the whole family sphere earlier, but what did that actually look like on a day-to-day basis?
Okay, so picture this.
Hmm.
You've got this surge of medical guides aimed at families, mothers especially, but these weren't your typical, boring medical textbooks. Think more like what to expect when you're expecting.
Okay, I'm picturing it.
But with the side of your baby's health, it's basically the fate of the nation.
Okay, maybe a tad dramatic, but I get the point. It sounded a lot of pressure on parents, especially moms.
Oh, totally. And these books weren't just about practical stuff. They were full of moralizing. Like, a healthy child wasn't just good for the family, it was a civic duty. Doctors were really pushing that noso-political agenda, linking individual health to, like, the strength of the whole nation.
Wow. It makes you wonder, was this empowering for women or just another way to, like, control them? You're getting knowledge, but it's a lot of pressure to live up to these, like you said, often idealized standards.
That's the million-dollar question, isn't it? And like most things in history, it was probably a bit of both. Some women, they probably found this knowledge like totally empowering. Others, they probably felt the weight of those expectations, especially given, how few resources were available to a lot of people back then.
It's a good reminder that progress, well, it's not always a straight line. Even with the best intentions, new ideas can have, unintended consequences.
100%. And as we've seen, the 18th century, it was a time of massive change. You had these traditional power structures, but they were being challenged by these new ways of thinking about reason, about progress, even about the role of the government. And public health, this whole idea of noso-politics, it was all part of that.
It's been an amazing journey, and it's really incredible how much these 18th century debates about health, society, individual responsibility, it's still relevant today.
Totally. We're still dealing with these issues. Healthcare access, public health crises, even the ethics of all this new medical technology. We can't forget, these aren't just scientific or technical problems. They're rooted in, centuries-old social, political, and economic forces.
It's a lot to think about, but that's what we do here on the Deep Dive. And for those of you listening, remember, understanding the past, it can help us make sense of the present. So keep asking those questions, keep digging deeper, and most importantly,
Keep those brains buzzing.
exactly. Thanks for joining us on this trip through time. Until next time, keep exploring and stay curious.